Over 100 years ago, Freud predicted the future of therapy. In lines of advance in psychoanalytic therapy, Freud explains that psychoanalysis was never made to be complete or perfect, and it must stay open to change, learning, and keep improving to better help patients. At the same time, Freud argues that the method should become more flexible and accessible, especially so that even the poor could receive psychoanalysis, possibly for free through public services. However, Freud also insists that even if psychoanalysis evolves and adapts to new social conditions, its most important valuable elements will always come from its core psychoanalytic principles. At the beginning of the paper, Freud says that after the long and difficult years that had kept people apart within the psychoanalytic field, Freud says he feels the need to look again at psychoanalytic therapy because psychoanalysis has its place in society and to consider new ways it might develop in the future. In this paper, Freud says that the task of the analyst is to help the patient become aware of the unconscious and repressed impulses within them, and to uncover the resistances that stand in the way of that self-knowledge. But Freud ponders whether simply uncovering these resistances is enough to overcome them, and he concludes that it's not always enough. Freud explains that the hope is to overcome resistance by using the patient's transference onto the analyst, so the patient can come to accept that the repression formed in childhood is no longer useful and that life cannot be lived according to the pleasure principle alone. Freud explains that the work of bringing repressed mental material into the patient's awareness is called psychoanalysis. He says that it's called analysis because it's a word that means breaking something down into parts, and it's often used in chemistry. Freud says that the comparison with chemistry is meaningful because a patient's symptoms and mental expressions are complex, made up of many parts. At the core are motives and instinctual impulses, but the patient either does not know them at all or knows very little about them. The aim of psychoanalysis is to help the patient understand how these complex mental formations are built. The analyst traces the symptoms back to the instinctual impulses behind them and make the patient aware of these hidden motives that were previously unknown to them. Freud compares this to how a chemist separates a basic element from a substance in which it was mixed and therefore unrecognizable. In the same way, even in parts of the patient's mental life that are not considered pathological, the analyst shows that the patient is only partly aware of what motivates them. Other instinctual impulses which the patient does not recognize also play a role in shaping their thoughts and actions. Because of the comparison with chemistry, one might think that psychoanalysis should go further. If psychoanalysis means breaking things down into parts, then it might seem natural that the next step would be to put those parts back together in a better way. This idea has been suggested by others. Freud explains that some people have argued that after analyzing a patient's mind, there should be a synthesis, meaning a rebuilding or recombining of the mental parts. They have also worried that patients might receive too much analysis and not enough of this rebuilding. As a result, some have begun to place all the importance of this synthesis, seeing it as the main healing factor, almost like restoring something that had been taken apart or damaged during the analytic process. Freud says that this idea of psychosynthesis does not give analysts any new task. Freud highlights that, unlike in chemistry, mental elements naturally reconnect. When analysis breaks down symptoms or separates impulses, these do not remain isolated but quickly form new connections. A neurotic mind starts off divided, but as inner resistances are removed, it gradually comes back together, with the ego reintegrating what was split off. Freud concludes that this process of rebuilding happens automatically during analysis, and it does not require a separate step by the analyst, because once resistance are lifted, the mind reorganizes itself on its own. Freud explains that therapy already involves active work, making repressed material conscious and identifying resistances. However, he questions whether it is enough to simply point out these resistances and leave the patient to deal with them alone. And he says that it's not, because the analyst should also help by creating the right mental conditions for resolving inner conflicts, since the patient's progress depends partly on external factors. This leads to a new aspect of analytic technique, which Freud says will require clear rules. He introduces a key guiding principle. Analytic work should take place under abstinence. By this, he means not simply refraining from all satisfaction, but it has to do with the dynamics of falling ill and recovering. Freud says that symptoms provide a substitute satisfaction, and if suffering disappears too quickly, the drive for recovery weakens, putting the analytic work at risk. Some level of difficulty must remain for real progress. As symptoms fade, patients may replace them with new forms of satisfaction that divert energy away from the analytic work. The analyst must recognize and challenge these shifts. In some cases, these substitutes can take stronger forms, such as relationships, unhappy marriages, or even illness, which unconsciously serve guilt or self-punishment while replacing the neuroses. Freud argues that the analyst must prevent patients from forming premature substitute satisfaction that replace symptoms too quickly. This requires firmly blocking earlier replacements with new comforts. Another kind of substitute satisfaction that can appear during analysis, but it's easier to handle, is that the patient may try to find the dissatisfaction inside the treatment itself, often by becoming emotionally dependent on the analyst. Some flexibility is allowed, but it should stay within limits. Freud warns that excessive comfort weakens the analytic work, similar to institutions that focus only on making patients feel comfortable rather than helping them change. In analysis, satisfying the patient's wishes too fully is counterproductive. The key desires should remain unfulfilled, especially the strongest ones, because withholding them helps maintain the therapeutic process and supports real change. In this paper, Freud rejects the idea associated with figures like Carl Jung that the analyst should take control of the patient's life by making decisions for them or trying to shape the patient into their own image. Freud maintains that the analyst should not remake the patient, and successful analytic work does not require this. Patients can improve while remaining very different from the analyst's personality. However, Freud softens earlier rigid views, admitting that some patients need more guidance. At times, the analyst may take on a limited educational or supportive role, where there are moments when the analyst must act a bit like a teacher or a mentor. Even so, this must be done carefully. with the aim of not shaping the patient into someone else, but helping them become more fully themselves by maintaining the fundamental goal of protecting the patient's individuality. Freud explains that different disorders require different approaches, so analysis cannot be applied in the same way to everyone. With phobias, simply waiting for insight is not enough because the patient avoids the very situations needed for progress. In severe cases, the analyst must encourage the patient to face the fear so that the material can emerge and be worked through. In severe obsessive behaviors, passive analysis is even less effective, often producing insight without real change. He concludes that these examples show how psychoanalysis must adapt its method depending on the condition. Freud reflects on the limits of psychoanalysis, noting that only a small number of analysts exist and therapy is mostly accessible to wealthier patients, leaving many others without help. Freud imagines a future where more psychoanalysts are trained and mental health is treated as seriously as physical illnesses, leading to public clinics to offer psychoanalytic care to everyone, possibly even for free. In this context, psychoanalysis would need to adapt by becoming simpler and more accessible, Freud says. Freud also notes that poor patients may sometimes be less willing to give up their neurosis because the illness can bring some sort of support. So treatment might need to include practical support alongside psychological work. Freud adds that large-scale therapy may combine psychoanalysis with other methods like suggestion or hypnosis, but he concludes that its most valuable elements will always come from true psychoanalysis, practiced carefully and without bias.